It is 10:27 right now. I am late to see my patient. Let's go. I'll explain what's happening later. So it is 10:30 in the morning. We have conservative dentistry in the dental faculty at our university, and I'm on my way to see my patient. So I've just arrived at the faculty of dental medicine in Plovdiv. Here, there's one of the hills. There's one of the hills that you can find in Plovdiv, and here is the faculty of dental medicine at our uni. Now I'm gonna go to the other side because this is the back entrance and it's blocked, so you have to go through the main entrance. So let's go over there. Welcome back everybody to a brand new video on the Dentist Saad channel. My name is Future Dentist Saad, and today we're doing something a little bit different. We're doing a semi day in the life because today I'm doing a collaboration with the Instagram vlogger and sensation, I'm joking, the Instagram vlogger called Shalini. Apparently that's how you pronounce it. I'll put her link in the description below so you can check it out after this video. But for now, I'm in the dental faculty, and what we are going to do is explain what an intra and extraoral checkup is like from a dentist's perspective, and you can go on her vlog later on and see it from the patient's perspective. So I'm in the dental faculty right now. As you can see, it is autumn season right now, November. I know it should be winter, but somehow it's autumn fever. So let's go inside so you guys can see what it's like from a dentist's point of view. So, once I have entered the dental faculty, the first thing to do is to put all my stuff away into the wardrobe downstairs and head to our clinic. So we are in our clinic right now. This is what the room looks like. There's a chair for my patient. And what I'm going to be doing right now is I'm going to disinfect this whole chair to get it ready for the patient, and then after that we'll call the patient in from the entrance right over there, and we can begin on the intra and extra oral checkup. Once I'm at my clinic, the first thing to do is to sign in and bring the patient up to the waiting room. If you're my patient, I will personally come down and collect you, so you get the exclusive Dentist Saad experience. You get me? Anyways, I take the patient down to the wardrobe as well, where you can drop your bags and jackets, and then we go back up to the clinic again in the department of conservative dentistry and endodontics. The patient then sits in the waiting room, and this is the time to disinfect the patient's chair with an alcohol solution to get it ready for treatment. So yeah, we're getting ready for our patient today. You know what I'm saying, gotta put the gloves on. Once the chair is ready, I'll come outside and call you in and take you to your chair. Would you like to come in? The next step is getting to know the patient's personal details and a short briefing on what I'm about to do. The first thing we're going to do is an extraoral examination, and then after that we'll do an intraoral, and we'll see if you have any problems with your teeth. I pick up a fresh set of sterilized dental instruments. Then you get a special bib just for my VIP patients. Well, you can leave your mask on.
I forgot I'm getting my teeth checked soon.
As students, we need to document all of our cases in this book. Book for operative dentistry and endodontistry. We start by giving out patients an antiseptic solution, which needs to be swished around in your mouth for a minute. You grab a cup, pour some in there. It's just enough for the patient to swish around their mouth for 1 minute, and then after that we can begin the oral checkup and any sort of treatment we need to. So come, let's give it to the patient. Trust me, I know it tastes bad, but it's for you and our benefit. Do not drink. Yeah, it does not taste good, does it? So while all this is going on, I've already asked you what issues you're having, and we can begin with the routine examination. How are you doing today?
I'm good.
Have you been brushing your teeth properly?
Yeah.
Flossing?
Yes.
Are you sure about that? We'll find out, man. We'll find out today, guys. Firstly, extraoral. This extraoral examination. We start by looking at the symmetry of your face. And then after that, because that just shows if you have any sort of problems on your right side or left side or anything like that. After that, we'll go into checking your TMJ so we can see if you have any jaw problems. And after that, we'll check your lymph nodes, and from there, we'll go into the intraoral examination. So, extraoral examination. I ask the patient to look right at me so I can check for facial asymmetries. Very good job. Now we check the temporomandibular joint of the lower jaw, which looks like this. In the TMJ, your temporomandibular joint is right over here. If you'd like to open your mouth, please.
Wait, did people say no?
Yeah, you can say just open it. Yeah, open your mouth slowly. Okay, close it. Open again. To the right. To the left. Okay, you can close your mouth. So your TMJ seems fine. There's no cracking. I don't see any popping sounds appearing. So good job on your TMJ. Smashed it, mate. Okay, next point. We're going to be looking at your lymph nodes. We're going to be seeing if there's any swelling or anything that shows any signs of infection, and we'll go from there. So, would you like to turn your head back a bit? Yeah, so I'm going to start with your salivary glands and all of your lymph nodes under your chin. I don't see any inflammation right there. I'm going to start with all of your lymph nodes over here. Your preauricular and your post-auricular lymph nodes. So there you go, congratulations, you do not have any infection. So one of our best patients so far. Let's see what happens next. So extraoral examination is done. The next thing we're going to be doing is the intraoral examination. Once we're done with the extraoral examination, the next thing to do is the intraoral examination of the teeth and soft tissues. Any sort of cuts or lesions there, or any sort of problems that we can find that we need to check up on. And then after that, we're going to be checking your teeth. So every single tooth, I'm going to go in an order, and we're going to check every single one to see if there's any problems. Here are my tools. This in Bulgarian is known as a complex. Complex, yeah. And when we open it, we have dental mirror, our dental probe, and our forceps. So I probably won't be using these today, we'll just need these two. Right, so let's start off by aligning the light properly. And sit back, relax, and open your eyes. Okay, so at this point of the intraoral examination, I'm examining the soft tissues, starting with the cheeks and moving to the lips. We start by checking the left cheek. You might be biting your cheek over here, maybe with your molar.
Yeah.
People with wisdom teeth tend to bite their cheeks, which can cause lesions, which in some cases may need treatment if severe. Then the right cheek.
Don't worry, I've got the same problem.
Then we check the lips for any lesions or anything worth noting.
Turn your head backwards. Like that way.
Yeah. Now we examine the hard and the soft palate and below the tongue, or sublingually.
Now we're going to be looking sublingually, which means below your tongue. So you can see your salivary glands right there. And face down a bit. There you go.
Everything seems to be in perfect working order. Congratulations. Your mucosa has no problem, so we can move on to the next.
Now I examine the teeth in a specific order.
So I'll start off with the last tooth on this side, and we'll come forward to your incisors and go to the other side, then we'll do your lower ones, just the same way. Alright, so we're starting off with 1-7, which is your maxillary second molar. Say I don't see any problem with that tooth. Next tooth. Now we're looking at 1-6, I don't see any problem there. So you can see 1-5 right here. It's pretty clean, very good job. 1-4 pretty clean. 1-3. Doing good job, that's the canine right there. 1-2 and 1-1. 1-2 is the lateral incisor, 1-1 is the central incisor. Just look at from the front. Pretty good job. So this side was fine. That's good, and we're going to keep going to that side. Okay. Have you had a restoration done with this tooth before?
A what?
A restoration, a composite filling or something like that?
No.
Oh, okay. It might just be transparency, it's fine. Alright, so let's keep going from there. Next tooth.
And just like that, I examined all the maxillary teeth, from her right molars to the central incisors to the left molars.
Congratulations, your upper teeth have no caries, they are perfectly fine. Now let's check the lower teeth.
Time for examination of the lower teeth, which is done in the exact same way as the upper teeth.
But if you have any questions throughout, let me know. And I'll answer them for you. Oh, you have your wisdom teeth on your lower. Oh, that's sick. I don't have mine yet. Let's go good there. Can you move your tongue to your left side? Okay, it doesn't seem like anything. So on 4-4 right here, there's a little white spot, and that is actually just fluorosis. It's caused by fluoride ions, and it's perfectly normal and healthy in your teeth. It's just caused by too much fluoride ions. It could be in the water, in the toothpaste, and whatever. I see a bit of calculus here, between these teeth and back here. You can see it in the mirror, on the lingual surface of 3-1. Can't see anything. I don't see any problems there, no problems there. I think that calls for finishing on your intraoral checkup. So I didn't notice any problems. You're basically fine. And at this point, if you were in my clinic, I would say, good job, give you a star, and send you off home. I saw someone comment on one of my videos asking what all these numbers mean in teeth. I'm guessing you want to as well. So basically, when we look at teeth, there's 4 quadrants that we need to know about. Your first quadrant is your upper right, this quadrant. This is number 1, 2, 3, and 4. So when I say, let's say 2, 1, it means the second quadrant, the first 2. Or if I say 2, 3, would be the second quadrant, and the third tooth, which would be the canine right over there. So that's basically what the numbers mean. The dentists aren't trying to speak in code, it's just an easier way to say this tooth. Do you have any questions as my patient? I would like to advise you on wherever you need. How did I do? Give me a rating.
10 out of 10.
10 out of 10! Best dentist, mate, I'm telling you. If you need a dentist, I'm right here.
Now once I am done with the checkup, the teacher does a quick checkup too, just to ensure that I've done my job correctly before we can start working on any problems the patient has.
In the UK they have a lot of fluoride in the water, so a lot of us have fluorosis because of it.
Look at her white
I was right, guys. I mentioned there's fluorosis. The doctor's noticing enough.
So, again, fluorosis here.
Free treatment, by the way, guys. If you need an oral checkup, hit me up. Instagram in the link below. Okay, so what's happening now is after we do an intro and extraoral checkup, the doctor comes along and she does an internal checkup as well, just to make sure that we've done the right thing. And so far, it seems like everything's fine. The only thing that she knows is fluorosis and a little bit of calculus, but that's it. Yes, that'll be pretty much it for today. I hope you had an amazing experience, and I hope you guys had an amazing experience watching our checkup. If you would like to check out her vlogs, she vlogs as well. This was
On Instagram, it's showers.
Link will be in the description. Anyways, come, let's take you out of here.
And now we see off the patient, and that is the end of the experience.
Goodbye, Shalini. Thank you for coming in. So guys, I'm outside the dental faculty right now. That was pretty much it for today. I hope you had an interesting time in seeing how we do an oral checkup for a patient. I hope this was interesting. If you want to see the other side of it from the patient's perspective, then go and check out Shalini's video. I will link her video in the description. check it out, subscribe to me, follow Shalini, follow my Instagram, and I'll see you guys in the next video.